Back now to the other breaking story of the day with Senator McConnell delaying the August recess and blaming his colleagues across the aisle. Listen.
We're getting zero cooperation as a result of all this obstructionism. Don't have enough time to address all of these issues. Therefore, we will be in session the first 2 weeks of August.
Here to react to that, one of those colleagues from across the aisle, Democratic Senator Van Hollen out of Maryland, joins us from Capitol Hill this afternoon. So he's blaming you guys. Let's start there. What do you say?
We've made it clear to Mitch McConnell from the very beginning that if he's interested in focusing on improving the Affordable Care Act, especially improving the exchanges, we're all in. But so long as he's working to blow up the Affordable Care Act and enact things that have nothing to do with improving health care, like cutting Medicaid for tens of millions of Americans while giving tax breaks to wealthy people, that's a non-starter. And I can tell you, having spent a lot of the 4th of July traveling around Maryland, including to lots of parts of our state that Trump did well in, not a single person out there supported this Senate Republican bill. So they should put that aside, and we've been asking to join them in trying to fix what we can and improve where we can without blowing the whole thing up.
Well, up until this week, Senator, we'd heard almost no talk of that, but we actually have heard from the Democratic leadership, Chuck Schumer on down, that the Democrats are there, to your point, to work together with Republicans. That would happen if there's not, as you know, enough Republican support for the bill. For, you know, the likes of Senator Rand Paul, but there are apparently maybe 10 Republicans who are not supportive of that. So then, if it gets to that point, hypothetically, where are the areas where you can come together? Give us a couple.
Well, I think trying to improve the Affordable Care Act exchanges. So, for example, there's been a lot of uncertainty in the cost-sharing payments. These are the payments that help deal with the risk within the risk pools for insurance companies. Those are an area where we can work together. I happen to think that we should also have a public option within the health care exchanges, because it would guarantee that you have a plan no matter where you live in the country. It would create more competition. According to the Congressional Budget Office, it would save taxpayers dollars. So there are lots of ideas if the goal is to try to improve the Affordable Care Act exchanges. But again, cutting Medicaid by close to $800 billion while providing tax breaks that go primarily to very wealthy people has nothing to do with improving health care, which may be why not a single patient advocacy group out there, not the American Heart Association, the American Cancer Society, not one, is in favor of what's supposed to be a health care bill.
Okay, on this wider question then of to move not away from health care, but to move on to some other subjects as well, about getting things done. Even the president has used similar language to Senator McConnell on Democratic obstructionism, I guess is the term that he's kind of coined on this. And in a recent tweet, he said the Senate Democrats have only confirmed 48 of 197 presidential nominees. They can't win, so all they do is slow things down and obstruct. And, you know, if you do look at the numbers, Senator, I think at this point, President Obama had over 50% of his nominees confirmed, 55, and the Trump administration's at about 20. So is that a fair point?
Well, there are a couple things here. I think it's important to look at the facts. First of all, the Obama administration put forth lots more nominations.
Yeah, but percentage-wise, I'm saying it was higher. It was higher, percentage-wise.
Yeah.
Right?
The other thing is this administration's put forward a huge number of nominees who haven't supplied their ethics paperwork to make sure there are no conflicts of interest. That has slowed down the process. And then when it came to this health care thing, I will tell you that when Mitch McConnell decided to set up his secret committee of 13 members, when he decided to not go to any of the committees for hearings and take public testimony, where he essentially shut this place down and abused what is the normal process, Democrats said, hey, look, we want the American public to be in on this health care thing, and as long as we're not going to have an opportunity to do that, we're not going to let you pass all this other stuff when you're trying to railroad the system.